to family history. It has
introduce Dr. Eman Radwan. Dr. Eman Radwan is a pathologist who completed her training in pathology at the Medical Research Institute, Alexandria University, Egypt. She got a master's degree in pathology and has over 4 years of experience as a research and teaching assistant at the Pathology Department, Medical Research Institute, Egypt. Dr. Radwan is interested in immunotherapy research and applying this type of therapy in different diseases, especially breast and lung cancer. So Dr. Eman, the floor is yours.
Thank you so much, Agafia, for the nice introduction. I'm going to share my screen. Thank you so much, Dr. Shafi, for giving me this great opportunity tonight. Good evening, everyone. Today, you know that our topic is living longer with diabetes, and I and my colleagues are going to share with you some important hints regarding living longer with diabetes. Let me first of all share with you some facts and numbers in Canada. The number of cases with type 1 and type 2 diagnosed diabetes in Canada is 3,772,000 in 2020, and this number is predicted to reach...
Hello?
Hello? Go ahead.
Oh, sorry. And this number is predicted to reach 4,891,000 by 2030. And this means that the increase in number of type 1 and type 2 diagnosed diabetes will be 30% from 2020 to 2030. That's why this topic is very important in Canada. And as Canadians, we have to learn about diabetes, whether we are diabetics or not, whether we are healthcare providers or not. Also, the direct cost to healthcare system was in 2020 was 3.8 billion, and it is expected to increase to 4.9 billion by 2030. So in order to live longer with diabetes, we have to have like a very strong programs for screening, prevention, and treatment. Are we able to do any of this without against the patient's will, for example, or without convincing the patient that he has to go for screening, he has to go for prevention, or he has to adhere to treatment? Absolutely not. We have to convince the patient. That's why diabetes empowerment is a very important topic. What is diabetes empowerment? Diabetes empowerment means that we need to empower our patients, diabetic patients. What is the definition of empowerment in general, patient empowerment in general? It is a process. In this process, patient will have the knowledge and self-awareness that will allow them to influence his own behavior, and not only his own behavior, also the behavior of others, to improve the quality of their lives. And the aim of patient empowerment is to give the patient the critical thinking required to make informed decisions regarding their healthy lives. So what will be the outcome of patient empowerment? Is it patient empowerment and that's it? No. Patient empowerment will be reflected on the healthcare provider. It will be reflected on the healthcare professional. And he will have the ability to discuss more with the patient and give him more time and give him more care. That's why empowerment is very important. In diabetes, there are three main pillars of empowerment in diabetes, and they are the belief that, first of all, diabetes is a patient-managed disease. Diabetes is totally different from any other disease, especially acute diseases. It will not be only managed by the healthcare provider. It needs to be managed by the patient himself. Second, the belief that the type of care that we are going to give to the patient is education and knowledge. Patient has the right to receive the appropriate knowledge and education to make informed decisions regarding their lives. And thirdly, the belief that patients should identify and implement their own treatment goals. He should identify the goal that he want to reach, like preventing cardiovascular complication, like preventing retinal detachment. So these are the three main pillars of empowerment. Now we understand the definition of empowerment and the main pillars of empowerment. We need now to understand the process of empowerment itself. There are 5 steps in the process of empowerment. The first 2 steps start with when the healthcare provider sit with the patient and start to identify the problem. He start to define this type of disease. He start to define what is diabetes. And then he will listen from the patient what is his beliefs or thoughts in order to understand if this patient is going to support his effort or not. The third step is to identify the long-term goal to where the patient would work. For example, the long-term goal of this patient would be preventing cardiovascular complications or preventing retinal detachment, preventing kidney disease. This is the long-term goal of the patient. Then the fourth step will enable the patient to identify a behavioral change that he will stick to in order to reach his goal. For example, for preventing cardiovascular complication, he will do a behavioral change regarding his diet. For example, he will follow a diet with low cholesterol, for example. So this is the behavior change that he would be responsible for. And the final step is for the patient to evaluate his effort and to identify what he learned in the process. So now we can understand that empowerment is not only a strategy or a technique for treatment. No, empowerment is a vision that helps people to have their own informed decisions. And also the potential of empowerment is not only regarding one individual. It will not only help one individual to make their own decision, it will help the whole community, because when one patient is empowered, he will reflect all the empowerment to his friends, family members, and so on. So now, as normal people in the society, we are not healthcare providers. We are normal people in the society. Can we do any role in the empowerment? Now we understand that empowerment mainly comes from the healthcare provider. But as normal people, we have to do a role, to play a role, even if it's a small role in our society. We can play this role by doing education and conveying authentic information. We have to know like a very basic information regarding diabetes, and then we can share this information with our friends. We can share this information with our family members, because by this way they will know that diabetes is a preventable disease or it's a treatable disease, and we can prevent all the complications, and thus they will be empowered and empowering all people surrounding them, and they will be able to discuss more with their healthcare providers. So now let's learn about some important information or some important tips. First of all, most of the patients, when they receive first diagnosis, they freak out and they say, no, it's not my diagnosis. I will go to repeat the test. No, it's not a mistake, and it's true. And we have to behave accordingly. And now we have to search for what are the routine that we should adhere to. So first of all, it's not a mistake, and we should behave according to this diagnosis. And secondly, we should not freak out, because this is not the known historic diabetes. This is not the diabetes of our grandmothers. Now, with all the modern medicine and all the treatments available, we can prevent all the terrible outcomes such as blindness, amputations, and kidney problems. Now can be not visible even because of the old modern medicine. So also we should know that type 2 diabetes in a specific, or diabetes in general, it's not anyone's fault. Please do not blame yourself. It is related to some genes. It is related to family history. It has a strong correlation with family history. So do not blame yourself, and just try to react to the diagnosis and behave according to this diagnosis. And then knowing the numbers is very important. People should know their numbers, their A1C level, their blood pressure, lipid profile, because by knowing this number, we can prevent many complications. Also, there is a rumor that's saying that diabetics are limited to eating breadseed, nuts, and they are prevented from eating many types of food. This is rumor. This is not true. Diabetics are allowed to eat many types of food, but not frequently and in smaller portions. And if we think here, we can find that everyone in the world, if he follows like a very good diet and a healthy diet, he will have a healthy life. So not only diabetics are the ones that we should tell them, no, you should not eat this and that. All of us, we should follow a healthy diet. And unfortunately, some diabetics say that I do not want to adhere to this type of medications. Medications have side effects, and I do not take many medications. But here, we should think of the advantages and the disadvantages. So medications are very important to treat diabetes and prevent all the long-term complications of diabetes. So we cannot say that. We should encourage our family members, we should encourage our friends that medications for diabetes are very important, and they will help you to live longer with diabetes. Also, protecting the cardiovascular system is essential. Why it is essential? Because it is the main reason behind living longer with diabetes. Taking care of your heart. Taking care of your heart is very important. And how should I take care of my heart? By stopping smoking or avoiding smoking, by taking care of my blood pressure and my lipid profile, as I said before, A1C level, and having a healthy lifestyle such as exercising. Again, healthy lifestyle is very important, and this does not mean that we should reduce our weights. No, this is not the idea. The idea is that we should have a healthy lifestyle. We should eat plenty of vegetables, plenty of fruits. We should have a fixed workout on a daily basis. That's how we could achieve a healthy lifestyle, and at the same time, we will reduce our weights, and accordingly, we will prevent diabetes or even live longer with diabetes. And at the end, do not do diabetes alone. We should encourage our friends and family members that have someone who is very close to you, someone who supports you all the time, because diabetes is something that is overwhelming, right? Because the patient, when he takes care of himself, he will concentrate on what to eat, what not to eat. He will concentrate on having a daily workout. He will concentrate on his medications. He has to concentrate on many things. That's why diabetes should not be done alone. We should have someone who we trust, or even this one could be our healthcare provider, because if we follow the empowerment and if we become we trusted our healthcare provider, this one who could be our healthcare provider, we should discuss everything with him and trust him a lot. So now we understand the concept of empowerment. We understand what very basic information that could we share with our friends and family members that could prevent them from diabetes or encourage them to have treatment for diabetes and prevent the long-term complications of diabetes. Those are my references, and I hope that you enjoyed the presentation. Thank you so much for your attention, and if you have any questions, please reach out to me. Thank you.